We have been talking about several emergencies that can occur in the public places or at home, and what a bystander is supposed to know and do before even the healthcare workers come, including ambulance. So, what if you witness somebody having seizures? You know what? There are many people during fits, just because they have seizures, and during that episode there was this block of airway here, because tongue falls back and it blocks the airway. For example, you witness a person getting into a seizure attack. So what is a seizure attack? Suddenly person loses his consciousness. There will be we call it generalized tonic clonic convulsions. Convulsion means like this. So he will just collapse, person or patient collapses on the floor, and then he will do like this for some time. Usually a seizure lasts for a few minutes. During that time, even if you want to restrain the person, you can't do anything. We know in many villages, even in cities, people tend to keep keys, bike keys, scooter keys, or some iron things in the hand, thinking that it will prevent the episode. So I would like to say that it is a myth that it is not going to prevent. In fact, it can damage the person also. And some people try to open the mouth because there is froth coming in. They try to clean. Don't ever do it, because they don't know that somebody is keeping their fingers in the mouth, because they might bite. You can't even retrieve your finger back. If the patient is seizing, which means he is throwing fits, all you should do is to take the patient away, make the place safer for the patient. That's all. Which means if he is hitting on something, just make sure that you remove those things in and around, and give him space. Because during that time, whatever you may do, you can't control it. And if he is biting his tongue, or if he is, let us say, frothing, for that moment you can't do anything. Just wait. Don't insert anything in the mouth, because that will even more damage even more. And don't try to keep any iron things in the hand. That is one thing. Usually in 1 or 2 minutes, maximum 3 to 4 minutes, it will stop. Okay. Now after that, what will happen? So once the patient throws the fit, when the fit is over, they go into a stage of unconsciousness for a few minutes. It is this time that what can happen is either the secretions in the mouth and throat, or the tongue itself can fall and then block the airway. Third thing is, if the patient has bitten the tongue, for example, already, and there is tongue injury and bleeding, that can also go back, and it can get into the lungs and then cause what is called as aspiration, which can cause future complications. All you need to do is, at that point of time, of course, you call for help or call for ambulance, and then you remove clean the surroundings, clear the surroundings, so that he will not hurt himself. And then once the throwing seizure is over and the patient is going into unconscious state, turn the patient to one side, preferably towards left side. We call it recovery position. So turn the patient to left side, hand like this, also the leg on top of the other leg, little bit front. So once you do that, what will happen? If there are any secretions, they tend to come out through nose and mouth outside rather than going inside. And then keep the chin lifted up like this, so that airway is opened and they breathe. So any patient who is unconscious, there is a methodology of checking whether they are breathing or whether the heart is beating. That comes under basic life support, which I will explain later. So for now, we presume that patient is stable in the sense that he is breathing, and then you keep the patient in recovery position. Most of the times they get up after a few minutes. Anyhow, you would have already summoned for ambulance, or you would have organized for transport. Once the patient recovers, you can in the recovery position, you can always transport the patient. Do not transport the patient in a supine position like this, lying like this, because as I said before, the secretions may block the airway. or secretions may go into the lungs where it can cause pneumonia and lung damage. This is all what we can do in patients with seizures. Thank you so much.